So you had surgery, and the doctor who did your surgery is not the one who's following you. Have never seen you after surgery at all. Does that pose some questions in your head? Would you consider that routine? Would you consider it normal? Would you consider it the standard of care? I find it hard to understand why the doctor who operated on you is not involved in your care at all. In medicine, we have ancillary staff. We may have other doctors. We may have other nurses. And they all play a part in your care. But what I don't quite understand when the surgeon who operated on you, they may have done your liposuction, your BBL, your eyelid surgery, your tummy tuck, whatever it is. The standard of care should be that doctor should at least see you at some point after surgery. He may not have to be involved in every visit that you actually have. But I think it's important that the doctor who did your surgery sees you and maintains some degree of follow-up with you, even when other ancillary staff are involved with your care. Okay? The reason why it's important for the surgeon that did your surgery to see you and follow you is the fact that he's the person that has the most knowledge about your surgery. He's the one that was involved in your surgery. He's the one that did your surgery. He knows this technique. He knows what the normal recovery should look like. He knows where basically when the recovery is not following the normal standard and it's not being formed after someone does not know, hoping, okay, I think they're doing fine. No. The idea here is to look at the good things, what's normal, but also to look at when care is deviating slightly from what normally happens. He's the one who's supposed to have your pre-op conversation with you and discuss your surgery in detail. So he should have an understanding exactly what your expectation is. But beyond that, we also want to be involved with your care because we want to see things that are not from the standard. So if there's an issue, it can be addressed as early as possible to avoid complication. Or if there's a complication, is to address that complication as early as possible. These surgeries, and it doesn't matter what any surgery at all, but these surgeries that we're doing are elective surgery. They don't have to be done. It's a decision that's made, it's a choice that is made to be done. But it doesn't make that surgery any less than any other surgery that you have, even the ones that you must have, and the important ones. They should all follow the same standard of care. What I like personally is that I like to see my patients before surgery in the consultation. I also, I'm the one that does the surgery. It's not being formed out to another person in the OR. Besides that, I'm the one that sees you post-operatively, and I'm involved in every post-operative care. And since we mentioned post-operative care, an important thing is your post-operative care is just as important as your surgery. Also, your consultation is also as important. They're all important things. It is a package. And it's not for you or for someone to dismantle that package. It's to keep it whole and to follow you throughout your progress and healing. So it is important that the surgeon that did your surgery is involved in your post-op care. And there will be ancillary people that are involved in your care, but the responsibility is not passed off to somebody else. They're assisting the doctor to maintain your care. Not out of sight, out of mind. No. Post-op care should be monitored and when possible, be done by the doctor who does the surgery. We have colleagues, okay? And if we have to pass off your post-operative care, it should be passed off to someone, I'm not a doctor, that have knowledge about your surgery. A colleague, a partner associate, not to the medical technician, not to the patient consultant, not to the masseuse. These people are important, don't get me wrong, but there is a certain place where they should be involved in your care, and there's a certain place where they should not be involved in the care. It should be the doctor's responsibility. With that said, thank you guys, appreciate it. Make sure your doctor is involved in your pre, post, and surgical care throughout the process. Thank you.